All right, so with rising COVID cases and the start of school now not too far off, although don't tell my kids that, the debate over masks in the classroom is reigniting around the country.
Yes, Boston's mayor, of course, just announcing that students in the city will wear masks come fall. Dr. Kristen Moffatt is an infectious disease specialist at Boston Children's Hospital. Dr. Moffatt, as always, thank you for being here.
Sure. Thanks for having me.
So I feel like summer just started, but let's talk about back to school. What is your level of concern for the fall?
Well, I'll start by saying that my level of concern this fall is not nearly as high as it was this time last year, and that's really because of vaccines. I do have some increased level of concern, though, based on just how contagious the Delta variant is and how it's really predominating in infections right now. But that's offset by our knowledge of just how effective our available vaccines are against the Delta variant. I think taking all of this together, though, given that vaccines aren't available yet for those under 12, given how difficult and complex it would be to confirm who in the school has been vaccinated and who's not, I think it's a reasonable step to still lean in towards masks for everyone who's returning to school in the fall, and that's especially the case for settings where cases are on the rise. We know from last year's experience that masks in schools are one of the most effective ways of keeping transmission in schools at a minimum.
All right, so before we get to the school year, there are still plenty of summer vacations to be had. Many families are traveling again right now, and that includes, maybe unlike last year, leaving New England. So what precautions should we be taking, especially if we've got kids who are under 12 that frankly can't get those shots yet?
The first thing I would recommend for those families is that everyone in the family who is eligible to be vaccinated get vaccinated. And I would really have families encourage the same of everyone who they're going to be visiting when they're traveling, and certainly everyone who they'll be staying with. I think beyond that, it's important to start to manage the expectations of unvaccinated children around masking conditions when they're traveling. Remind them that masks are still required for everybody in airports and on airplanes, and that they're still recommended for people who haven't been vaccinated if you're spending time indoors with people outside of your household. And lastly, I would really encourage even those who have been vaccinated to reconsider putting a mask back on when they're headed indoors while they're traveling, and that's especially true if their destination is seeing rising cases right now.
Okay, so today, federal health officials, they met to consider booster shots. While they didn't make a decision, that's a big question for a lot of people right now. We're talking about it. What message are you giving to patients about how much protection the existing vaccines are providing? Because we're hearing kind of mixed signals with the Delta variant.
Yeah, so I'm still very confident about the data, and I'm telling patients that the vaccines we have available here in the U.S. remain very, very effective, especially at preventing severe illness from COVID-19 infection, including illness with the Delta variant. I think that it is important to understand that some of the laboratory-based studies that have gotten a lot of coverage this week for predicting perhaps some vaccines being less effective against the Delta variant than others, while those are really important studies and data to have, they are not always the most accurate at predicting what actually happens with viral transmission in people and in populations. So we really need this in real life data about infections in vaccinated people to really make better determinations about the effectiveness and the need for boosters. Data like those are coming. Additionally, data around the safety of boosters should be forthcoming in just a matter of weeks as well. So with all of that information taken together, we should be able to have much more informed guidance around the role of boosters and if they're needed.
All right, Dr. Kristen Moffatt, we'll have to leave it there, although we've got a lot more questions, but we'll see you next week. Thanks so much for your time.
Yeah, sure, thanks.